Hello, 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 beautiful people. I am Nicci Gilbert-Daniels. Please forgive me. My name is not labeled correctly. Honey, I love you. I am so excited to be hosting and co-hosting this conversation today. A very, very important conversation on HIV awareness. And I am grateful. I am so grateful for this incredible group of women, these experts, these beautiful women of color who have taken the time out to share their expertise. I'm excited to get educated. Usually I'm a talker, but I'm going to do a whole lot of listening. And I am going to let my co-host and chair of From the Bottom Up Foundation, Pamela Price, I call her Pam Credible. Pam Credible. Ladies and gentlemen, this is Pamela Price, and she is an amazing woman. And Pam, take the floor, sis. Why is it so important for us to be here tonight? Pam, you there?
That mute button. You would think with all the time we have spent in this digital space that we would not lose that dreaded mute button. But that was where I was happening. So thank you again, Nicci, so much. I think just for one, I love that you like to use your platforms to have conversations like this, right? Because you would have most who would not, who would still be feeling that HIV is taboo and that we should be talking about it. And, you know, we've been dealing with this for 40 years. What is left to be said? And so I do want to just commend you because I know that not everyone would have been so gracious with your time. And again, with all your multiple platforms and everything that you have going on that I'm always honored to be a part of. And I also just want to thank everyone for joining us tonight. I'm really excited. I've been really geeked about this. All three of these amazing women who we invited and they graciously said yes to be a part of this conversation are women that I have either been able to meet or I saw them talk and speak in some way about HIV in a way that I really feel is going to resonate with us tonight. So without further ado, I want to introduce the amazing guest that we have with us tonight. And I want to start first with Dr. Oni Blackstock. Dr. Oni Blackstock, to me, and she has a long, extensive bio. If you don't know, she's Googleable. Okay, her and her twin sister. Okay, Google her, as my kids would say. But she is not only just a phenomenal human being, but she is a Black female HIV primary care physician. And we know we need more like her in this space. She is a health justice advocate in this space as well, really just thinking about equity across the board. So I cannot be more excited to have you with us, Dr. Blackstock. Then I also want to introduce Ms. Zakia Jamasier McKensey. I know this beautiful human. We go way back to my time at working with the Virginia Department of Health and the Richmond City Health Department. That seems like many years ago because Zakia is with us today as the executive director of her own foundation, Nationz Foundation, doing work in the LGBTQIA plus community. And again, she is just another phenomenal spirit and human being. I'm really excited that you guys are going to get an opportunity to hear from her. And she's also an actress now. I want to shout out on that. If you have not caught the CNN docuseries Blind Angels, I strongly suggest that you watch that. She is featured in one of the episodes of that docuseries. And if you are at all interested in what HIV and it is how it is impacting these communities, like those women and girls and like the communities we're going to talk about today, I implore you to please watch that docuseries because it is amazing. And then definitely last but not least, Reverend Dr. Dominque Robinson. I got to actually know Reverend Robinson through her work and support with the Balm in Gilead, where I am currently the deputy director. She actually joined us for this year's National Week of Prayer for the Healing of AIDS, which is our 36th year of having these conversations. And we started a series called The Doctor and the Preacher. Right? Because I think when we talk about HIV and anything else going on, we need to be talking to a doctor like Dr. Blackstock, and I hope are talking to our pastor or somebody as we figure out how to navigate these situations. And so Reverend Robinson, again, I think she's a breath of fresh air. She's a womanist. She is also an advocate, and her spirit and her energy, I think, for making sure that we can have those difficult conversations, even in our most sacred places like our faith institutions, I think is important for us to have today. So without further ado, we were asked kind of why. I know we got a couple of side eyes when we're like, why are we having this conversation? We get that it's National Women and Girls HIV/AIDS Awareness Day, but why, as Black people, are we still talking about HIV? And as we've been sharing leading up to this event, we are still talking about it and must be talking about it because we're still dying from it. The reality is that African Americans still die from something that is 100% preventable. We are 40 plus years into these conversations and into the work about HIV. And there are the amount of treatment options, both for HIV positive individuals and for those of us who are HIV negative, has so far shifted from where we started 40 years ago. So to still see that we, Black people, we are the face of HIV. However you slice our communities, we rise to the top of new diagnoses. We rise to the top of those living with HIV, and we rise to the top, unfortunately, from those who are also dying with HIV. So as long as those numbers, as long as the data shows that, we must continue to have these conversations. So I wanted to frame that because that is our why. As we talk, as you listen throughout the panelists, speak and share today, I really hope that you'll start to think about what your why is. What conversations have you not had? And things that need to be happening in your homes, in our families, and in our communities, so that we can again begin to stem this tide. Because Lord knows there's many other conversations we also need to be having, but today we're talking about HIV. So we are going to spend some time talking with Dr. Blackstock, specifically just coming and getting her perspective as a physician, as a woman of color, as someone who has been, really, I think, on the front lines of HIV as a primary care physician. And then we'll continue this conversation. So I want to take this moment now to bring up Dr. Blackstock.
Thank you so much, Pamela and Nicci, for having me. I'm truly, truly honored to be here with you both.
Thank you so much. Again, I was sitting in the office when I got the email that you were available and did a big happy dance. So thank you again.
And she sent the energy to us via text. She was very excited about it, and we were too. So thank you.
Thank you.
So, Dr. Blackstock, I want to first just ask you, so as a primary care physician, right, what do you see as some of our biggest issues? If we think about, again, maybe where we were, but even where we are now, what are some of the challenges and barriers that we still continue to see in this space of HIV?
Wow. Yeah, I would first start with this statistic that I heard a colleague share, and that it's the likelihood of a Black woman being diagnosed with cervical cancer is sort of on par with the likelihood of her dying. I believe it was dying of HIV. And I will just double check, make sure I got that right. It's either dying of HIV or being diagnosed. But the main thing is what I'm saying, and I believe it's being diagnosed with HIV. But the main point is that if you went to your healthcare provider and they said they didn't ask you about whether you wanted a pap smear, or you asked them for a pap smear and they turned you down, you would go to another provider. But when it comes to, for instance, HIV testing, which is something that all primary care doctors should be offering their patients, right, we don't really bat an eye if that doesn't come up. And the issue is a lot of time primary care providers, sort of have assumptions about who might be at risk and who might not be. And often our assumptions are completely wrong because a lot of it doesn't have to do with necessarily, especially for women, a woman's individual behaviors, but a lot of times what's going on around her, maybe in her community or with her partner, whether she's living in poverty. All of those things can contribute. So, I just wanting to highlight that we want to make sure that people are advocating for themselves, and the CDC recommends that at least once in your lifetime that you be tested for HIV.
That That's alarming, because I think for a lot of individuals, when we go to any physician, right, it definitely are, I think, our primary care physicians that we probably see more than any other type of provider. And we are trusting, right, that if it's something that we need, they will be the ones prompting us to do that. What do you think causes perhaps that that willingness maybe not to offer it, since it's a part of most best standards of practice now?
Yes, well, I think there's a lot of it also has to do with just the training that health professionals have. And the reality is many health professionals feel uncomfortable talking about, someone's, sexual history, even though we know sexual health is a part of one's overall health. So a lot of it is like health professionals getting comfortable with that conversation, and also talking about sex and sexual activity and pleasure in ways that are sex positive and affirming and aren't like risk-based. Because often when these discussions come up, it's about, what are you doing wrong? Or, if Black women are at high risk, and that may turn people off, or people might get disconnected because they may say, you know what, well, I'm not at risk. But if we flip it and we talk about, here are some ways that you can, feel empowered or protect your health, or have some agency about, your own sexual health, I think that positive framing can help. And it reminds me of this campaign that ViiV Healthcare has. It's a pharmaceutical company. It's called Moving from Risks to Reasons. So not talking about what your risks are, but what are your reasons for coming into care? What are your reasons for taking care of yourself? So figuring out what are those things that women are doing already to take care of themselves, and sort of building on that versus having a more negative framing.
I love that. And kind of thinking just along those lines too. So we know if we're reframing it, both for us as women, and then we're also, perhaps by doing that, we can maybe remove some of the anxiety or anxiousness that healthcare providers may also be experiencing in terms of just having these difficult conversations. Now, when it comes to things like treatment though, right? So when we know, hey, look, we've asked, we've advocated, we've gotten a test, and let's say maybe our test now is positive, right? So now we're in this space of saying, I got to figure out and identify, what do I do for care, right? So where I know we were not the best of places 40 years ago, but thinking about where we are now, can you share like just the spectrum of treatment options that we have right now?
Yeah, totally. And I just want to give a head nod to, early on in the HIV/AIDS epidemic, people used to say women die from AIDS, but they don't get it. Or women have AIDS or they don't get it. I'm sorry, I'm getting a little mixed up. But basically, women, the conditions that women died of, often cervical cancer or had complications from pelvic inflammatory disease, all of these conditions, they were not part of the criteria for AIDS. So many women were living with HIV, were dying of AIDS. And in particular, I'm talking about cisgender women, although we know that transgender women in particular are disproportionately burdened by HIV. But thinking about cisgender women, many women couldn't get Medicaid or disability benefits because even though they were dying of AIDS, they did not meet the criteria for AIDS. So that's how we started. And we started with transgender women and cisgender women being invisibilized, right? HIV was a condition that primarily gay white men had. And that's really all you saw. Meanwhile, in our communities, we were seeing Black men being impacted, and we were seeing Black cis and trans women being impacted. So fast forward 40 years, when people, in the past, people would take, multiple times a day, handful of pills, multiple times a day, to now we have once a day treatment in one pill. It is absolutely amazing. And these medications are incredibly potent. They're very powerful. They can suppress someone's viral load within a few weeks if that person is taking it every day. And so I want to make sure the viewers know that if someone has an undetectable viral load, if their virus cannot be detected on our usual routine tests, they have effectively no risk of passing HIV on to their sexual partners. So treatment has a benefit for the individual as well as for the public. So we've made tremendous advancements. The main issue has been that even though we have this amazing treatment, we have PrEP, either once a day pill to prevent HIV infection or an injectable every 2 months, the reality is like, there are barriers to accessing these. So they are available, but they are not necessarily accessible, especially for Black folk, for a number of reasons. We're less likely to have access to have health insurance or access to quality health care because of structural racism. We're in communities where we need less access to quality health care. All of these things place us at risk for HIV, and they also make it hard to access treatment and prevention.
Wow.
So we've made advances, tremendous advances. HIV is not a death sentence. It's like, it is a condition that is often stigmatized, but it also is akin to like diabetes and high blood pressure in terms of being a chronic condition that you're managing over time.
Yeah. I did have a question about when we start talking about awareness. Are we in the schools, in the colleges and universities? And is there a way, and maybe this is, further down the line in the conversation, but has there been outreach as much as there used to be, I guess?
Yeah. I think, and that's such an excellent question. I mean, when you first asked that, it made me think about comprehensive sexual education. So we have lots of children who are in schools who are learning sex ed, and it is not up to date. Like, they are not learning about pre-exposure prophylaxis or PrEP, the strategy to prevent HIV if you're HIV negative. They're not learning about undetectable equals untransmittable, what I was mentioning about if someone is on meds, they're taking it, they're undetectable, they cannot transmit it to their partner. Young people are not learning about these things. And so that makes a lot of this harder. I know that there are a number of initiatives that are doing work in HBCUs and other community colleges and other sort of educational settings, but it's not like a comprehensive effort. These are often either hospitals or clinics or community-based organizations that are taking it upon themselves to do this type of outreach. But HIV is something I think people have really forgotten. Fortunately, many fewer people are being diagnosed and are dying of it, but we're seeing kind of like this browning of the epidemic. So we're seeing primarily be Black and Latino people who are diagnosed. We basically ended the epidemic among white Americans. This is largely a condition that affects Black and Latino people. Look at Nicci's looking at me like this.
She like,
yeah. So, and once things don't impact everybody, it's like, oh, we don't need to sort of deal with that as much anymore. So here we are with
mind blowing.
Yeah.
Mind blowing. I said I was going to be educated, and that just blew my mind.
What's even, I think, more alarming is that as you said, Dr. Blackstock, that we've kind of pretty much ended this epidemic in non-Black or Brown communities, and it's continued to, I'm not gonna say thrive, but it's definitely continued to exist disproportionately, is that the funding also has followed trend, right? So if we think about what we used to have as organizations like Health Justice, or organizations like we're going to hear from later with Zakia, that amount of funding that's being funneled, especially to more kind of community level based organizations, is nowhere near what it used to be. So, Nicci, like you were saying, to get to the schools, to get to the colleges, the funding has to be there. We also have to have the support and policy. So we have to have school officials and college administrators who are open to having these dialogue, who are open to saying, we'll allow you to come to our wellness centers. Most colleges have some type of wellness center, right? So I know here in Virginia, there are several of especially the HBCUs, who will allow their wellness centers to be used to at least do testing at a minimum. But I think it's conversations like this for people hearing to say why that's still needed, right? Why we still need to not just be on the college campuses. We need to figure out how to get to these high schoolers, because their numbers, that 13 to 18, 18 to 24, that's 13 years old for folks, because I've got 10-year-old twins that are, they're bumping up to that age. That's middle school. Yeah, that's middle school. So we've got our work cut out for us if we want to eventually see a future to where, we we're no longer the face of this condition, because whether it's, structural racism, biases, and everything else, the interest will wane because of who it's impacting. I know that's not nice to say, but that's why health inequities exist.
Exactly. Yeah, we just have to keep speaking up. And so much of the history of HIV has been driven by community. So much of the attention, Black women, white women going to the CDC and demanding that, women be considered, these conditions be considered as AIDS-defining illnesses so that women could be diagnosed appropriately and get the support that they need. And so it continues. There's a cadre, dozens, hundreds of Black women, cis and trans women who are continuing to speak up so we don't forget what is going on. And just to also just quickly say, the person who was president before the current president, which is so strange, I think someone got in his ear and was like, you can end this epidemic. So he actually set aside, there's a whole Ending the HIV Epidemic initiative that's going on where there's money that's been put to the side for this. But the sad part is right now, it's possible that Congress may be cutting all of the previous presidents ending the epidemic, the funding that was put aside for this, in addition to other HIV funding, some Ryan White funding, other CDC funding. And so if that happens, we could see lots of the gains that, lots of the progress that we've made reversed. So again, continuing to advocate and speak up.
Wow. What do you say? It's in every corner of this place.
Yeah.
It's crazy.
That policy piece, right? So if you're not in those spaces, you may not have known what Dr. Blackstock just shared with us. But now that you do know, again, that's where the advocacy comes. That's where, when it is time, when your local folks are back home in their offices and in their districts, that's the time to go to them to say, hey, look, this funding matters. This is how this funding is being able to help my community, my family, myself, right? They need to see us the same way they see other communities who are in their faces, they're writing letters, they're doing they are doing the most.
Yeah.
So that their, local, legislators know, hey, I'm here and I've got a group of 100, women who are telling me they don't want this taught in our school. We think about what's happening and we want to know why. It's because those individuals' voices got heard and perhaps they drowned out others, but we got to make sure that our voices are being heard.
Got to show up.
Yes, you have to show up.
Yeah, and just one other quick point is just so folks realize, all of what we're seeing in terms of anti-trans, anti-LGBTQ, anti-DEI, all of this is connected. We saw last year or the year before, the state of Tennessee refused its HIV prevention dollars from the CDC. It said, we don't need these $7-8 million. We don't need that. And they wanted to do their own thing. I believe the state, a lot of the CBO, community-based organizations, were still able to get some of that funding, but we're seeing a lot of this, happen in this current climate. So it's all tied together and all of our faiths are interlinked. So, if we are fighting for one thing, we need to make sure we're fighting for all of us.
Yes.
Wow. That is, disheartening, but at the same time, we know what we need to do collectively to get the awareness out there, because it just blows my mind that Black and brown people are impacted so negatively by this, and that there are resources that are available that could potentially, if I understood what you said, go away based on the fact that it's not impacting the larger group. And that is disheartening, but it's hard information that I think we have to face, just like this HIV issue 40 years later.
Exactly.
So I'm gonna, before we let Dr. Blackstock go, in case she has to hop off, I'm gonna bring in Zakia and bring in Reverend Robinson. I'd love to get both of you ladies' thoughts on anything that Dr. Blackstock has shared, and I'll start first with you, Zakia.
I was jotting down a lot of notes. Dr. Blackstock hit a lot of points, dropped a lot of important nuggets, especially about testing with your primary care physician. A lot of times when we are out doing outreach and offering testing, I get the response, oh, I'm good. I got it at my doctor's office. And I try to explain to folks that if you're not requesting that, then you are not getting that. And a lot of doctors don't want to talk about it, aren't educated about it. PrEP and PEP, they're not educated about it, don't want to talk about it. And these are tools that are available for you to protect yourself. These are resources that are available. So I think that the medical field needs to do a better job at teaching practitioners that are coming out of the school so that they will understand the tools that are available. Because if we are not, cultivating the leadership that is coming out, how are we going to change the process? How is it going to really end by 2030, right? And then she also said risk to reason. I have always talked about that. And with my organization, we provide a holistic approach, right? Because if you don't have somewhere to stay or you don't have food to eat, you're not going to concentrate on your health care. So why are these things happening? And then undetectable equals untransmittable. U equals you. I think people need to understand that. And yeah, I'm gonna stop on that. Those were the nuggets that I just thought were just really amazing. So thank you for sharing those things, and they were important.
Love it. And Reverend Robinson, how about you? What resonated with you?
Everything, but this one thing. I used to serve as a dean of chapel at an HBCU that I will not name, not because it's an issue with it, but I don't want anybody to think that this school was doing something incorrect. What I discovered was when we started to shift to adding a clinical psychologist and combining the Department of Religious Life along with health and wellness, is when we had a broader space to be able to say, okay, we need to talk about the things that have stigmas within our communities, and how do we do that in a particular way that allows our students to know if this is an abnormal conversation, it's an absolutely necessary conversation. And I got in a bit of trouble, but worth the trouble of making sure that I added the information to the regular chapel announcements and conversations. And so if you were the school required the students, they had to come to chapel. That's a whole nother conversation around religious freedom, but the students had to come to chapel. And a lot of them having to come to chapel, I wanted to be clear that this was not just a space about just Christian conversation, but about wholeness and wellness of humanity and who they were as individuals. And so to come in without having any kind of previous conversations around body, gender, sexuality, sensuality, and then freedoms to do whatever you think you should do at that age of adulthood, without having some other conversations on how to also just take care of yourself in all the ways, was important. And so I think it's absolutely necessary for us to bring the education to high schools, and certainly to HBCUs, which are supposed to be institutions founded to give the wellness, education, support, and love of our community and the persons who attend. And so I am saying to anybody who is serving in administration in the HBCU tuning in right now, you have heard it yourself from Dean Dominque Robinson, especially since you know where I worked, that you need to incorporate it into not just quote unquote the curriculum of syllabi, but the wellness of every single student who will be matriculating. And should I push it to say to your faculty and staff too?
Yes. Yes. So we already have our first call to action. Okay. That's the first call to action. I hope you heard it. I hope you caught it. Because that right there definitely was something I feel wholeheartedly is definitely needed, because we can have all the initiatives that we have. We can have, again, we got all the PrEP and PEP and once a day treatments, which we're there. We can get to a place where we actually start to have a vaccine, which is, so when we're really getting fancy and getting advanced with what we have in terms of treatment, right? We can have all of those things. But like you said, if we don't first understand what is available to us, how we can access those things, why we need to do it. And again, to say, we want you for our young people, this should not be a burden for you. It should be something that you see, for me to go out here and live the life I want to live, how I want to live it, then this is just something I can put in my wellness toolbox for me, right? So that you can, again, thrive and not, find yourself in a situation with the diagnosis that now you're having to maybe make changes in your life and seeing doctors and finding a physician that you can work with and partner with to treat you and become virally suppressed. And we want to prevent that. I think, again, we have so many tools in the arsenal now that really, really support preventing new HIV diagnoses. That right there, what you just said, is one of the ways that we can can start to hopefully shift this prevention conversation. Dr. Blackstock?
Yes, and can I just say, with my hat as CDC clinical HIV ambassador with Let's Stop HIV Together, just that make sure that folks who are watching know about the Let's Stop HIV Together campaign. And there's also a She's Well, is the campaign that's specifically focused on cis and trans women and HIV prevention. So if you go to Let's Stop HIV Together, you Google it, right, as young people say, and then put in like She's Well, you'll get information for that. And I just wanted to say to my wonderful co-panelists, I love how you both mentioned this idea of like a holistic approach, right? Like thinking about like what is the whole person, because I think that is one really important way that we can engage women and figure out what are women's priorities, what are their needs, and how can we align our messaging around HIV prevention and treatment with that.
Yes. Love it. Love it. All right. So we are going to keep this conversation rolling because I am really thoroughly enjoying it, and still also kind of like Nicci, I'm learning as we go too, and either texting or looking. So if you catch me looking down, I too am also got my pen and looking to take notes on things that maybe I didn't know of or ideas that I didn't think about. I do also, encourage you strongly to just Google the Let's Stop HIV Together. There are some awesome, there's materials, there's posters, there's postcards, there is actual videos of the U equals U, and the like they really put a really robust set, I think, of information and resources right at the fingertips of our communities. It's right there on the internet, and they didn't put it behind some fancy wall that you got to sign in. It literally is right there on the website for you to go and to utilize it as best you can. I know we'll be pulling it off and making it available on the From the Bottom Up Foundation.org, just to provide it as another resource. The Balm and Gilead is a PAC partner, so it is already on the Balm and Gilead's website. If you want to go there and find it, there's actually a widget if you need to get tested. And I'm gonna tell you now, if you are sexually active, anybody on this call, I'm talking to my single people, I'm talking to my married people, okay? If you are sexually out here or sexually active out here in these today's streets, okay? And you have not, to Zakia's point, I go to my doctor and she's drawing a lot of blood. But if I don't specifically ask her to throw in an HIV test, she is not doing it. So you have to be specific in saying, while y'all are running the blood, can you also please throw in an HIV test for that, please, doc? And I strongly to do it. If you have not had one in the last 6 months, and that's actually being quite generous because depending on how active you may be, it should maybe be 90 days. But we'll give you 6 months. We'll give ourselves some grace, right? But if you have not had an HIV test in the last 6 months and you're sexually active, you need to go tomorrow. It's Monday. Go tomorrow and just get a test. There are so many places that you can go, walk in. The test is 20 seconds and you're done and you're gone about the rest of your day. So I really, really, implore everyone to do that. So, and I know Zakia, who we're going to bring up next, is going to hammer that, because I love that is one of the things that she does through her foundation and her work with Nationz, with a Z, Foundation, right here in Richmond, Virginia. And again, first of all, I'm so proud of you. So I just want to say that right here. Because like I said, I'll never forget coming to Richmond City. Zakia was already there. I was coming up from the big state office down to the city office, and I loved her. I didn't know Zakia before then, but it was just something, I think, just about her, and I really, I loved her passion for the work that we were doing. And for the communities in which we were doing it with. So I just want to say, sitting here and getting to have a conversation with you now as the founder and director for your own organization, okay? So proud of you. So
thank you.
Can you tell us, first of all, why did you even want to create Nationz Foundation?
Wow. Well, first, before I answer that, I just want to say, Nicci, I am so honored to be in your presence. I have been a performer for many years, and Brownstone was one of my favorite groups to perform as an entertainer. So I just wanted to get that out of my spirit.
And
Like,
you're
I
not
feel
gonna
like
slide by and say you was a performer without telling me when we performing again, honey. Man, thank you. Thank you, thank you, thank you. And God bless you
yeah.
and thank you for being here.
Oh, no, thank you. So to answer the question, um, I have been in HIV prevention and education since about 1996. And I started using my platform as a former Miss Black America Plus to have conversation and to normalize talking about HIV in the clubs and as I traveled across the country. I worked for this organization called Fan Free Clinic, which is now Health Brigade, and I was very instrumental in starting all the transgender health services that are now existing in Virginia, doing HIV testing and education. And then after staying there for about a decade, I went to work for Richmond City Health District, the first trans woman to ever work in the health district as a disease intervention specialist. And doing that work, it gave me the opportunity to really identify individuals who were at risk or who had tested positive for HIV or STIs. Um, but I also had lost my drive for being in community and the programming that we did as a nonprofit organization when I was with Fan Free versus working with the state. And so I missed being in community. I missed the unique ways that we targeted people to get them in for testing and to make sure that they were taken care of. And while the health department wanted to infiltrate this population, they were not open to unique ways of meeting the community. Um, so I started the organization, and then it was like one day I told Pam, because Pam was my supervisor, I was like, "Girl, I think I'm getting ready to quit, and I think I'm gonna step out on faith and do my own thing." And my family thought I was absolutely crazy, but you have to trust God and trust the universe. And so it was just really important for me to not only, get people linked to care, but look at a holistic approach, right? And not only because of like your status, but LGBTQ people, like the doctor said about risk to reason, right?
Hmm.
With LGBTQ folks, there are a lot of things that impact us as a community that cause us to put ourselves at risk, right? And so it was just really important for me to create a space that was for all LGBTQ folks to have access to health care and wellness, regardless of your HIV status. But we do a lot of work in HIV prevention, a lot of work in testing. So it was really just to create a space so that my community, LGBTQ folks, and specifically trans folks who are really marginalized, have access to care and see people who look like them.
I love that. So let me ask you, what do you think some of the obstacles are in trying to do you have any issues? I know Dr. Oni was talking about outreach. You know what I mean? When you start talking about younger members of the LGBTQIA community, um, do you see obstacles when it comes to addressing the stigma attached to AIDS and HIV?
I think there will always be stigma attached to HIV and AIDS,
Hmm.
but I do think that outreach is extremely important, and that's one thing that Nationz prides itself on is meeting the community where they are, right? And
Hmm.
so we do a lot of outreach. We do outreach in the clubs, so we are right there where they are meeting people, and we're offering testing in the clubs. Nationz has 3 mobile testing units, so we are out in the streets at all times providing everything that we offer in office on those mobile units because transportation is a barrier for people. Oh, I
That's
can't get
amazing.
to
Yeah.
a testing site. So we're bringing the testing sites to you. We're downtown. We're in areas that people with low income, people who are facing poverty, people who are in food deserts. We are offering all of our services to the community.
That's incredible. That is absolutely incredible. Um, I'm blown away by your advocacy. And obviously, I have friends that are near and dear to me who are part of that community. I say all the time, what's really crazy, I'm share this little anecdote in this story. But before, living in your truth was as popular and received as it is today. I have a cousin. There was actually a scene on R&B Divas where I couldn't perform the song because I was so emotional about it, but he kept it to himself. He kept it to himself until, you know, and there have been so many advances, so I don't know if it would have happened either way, but it's just when you, my question is, families, how do you address the issues of families who aren't as supportive as they need to be?
So when you have, there are a lot of us, and one thing I can say is that within the LGBTQ community, a lot of times our family ostracize us because of who we are, who we love. And as a community, you know, we come together like a village to take care of our people. But we have created different nights. Like we have a Monday Night Madness that's just like a social support night where we're just playing spades, or we having dinner and we just chilling. But it is building community and making sure that we're there for people, providing different support groups. Like there's even a support group for people who are living with HIV. But just being there in every way that you can be, because it is difficult. You know, when I came out as trans, you know, that was a hard pill for my mom to swallow. And at 16, I was, you know, kicked out of the house. You saw that on the Blind Angels docuseries, but it was like community that I connected with that became my family, who grounded me, helped me to stay in school, and, you know, made sure that I was taken care of. So that's one thing that I can commend like our LGBTQ community for, is that we come together for one another and support one another.
Absolutely. And that should be the example for all people, in particular,
Yeah.
Black women.
Yeah.
You know,
Pam, do you have anything?
so I wanted to just piggyback on that. So I think, yes, championing and knowing we hear that, you know, when I was at the health department, you know, with Zakia, and we would, you know, folks are coming into the clinic and they're getting tested, and we're asking, you know, we're taking the sexual history, but, you know, all of us, I think, again, because we knew these individuals, right? Or we knew them, or they looked like folks who we knew. So, you know, there would be younger individuals who would come into me, and you kind of, you're getting this history, and you're seeing the high risk, right? Just the unsafetyness about what they're doing. And I think this is where the cultural competency, right? This is where the cultural proficiency comes into play. When you get away from what the paper says I should be asking, and then looking at this individual in front of me and wanting to know, okay, well, what is really happening with you, for you to put yourself at risk, that I'm looking at you and talking to you, that you know is potentially dangerous, you know, for you. And I think you would hear those types of stories. And I was kicked out of my home. Labels were put on me that I felt I had to subscribe to those labels, because that's the only thing my family was saying about me. So I think for all the stigma, and I think sometimes too for the resistance and the pushback and even the negativity that we can hear today in mainstream media, and in far too many places, especially in places where Black folks are congregating at, that to hear you champion your community, right? To say this, we came together to say, if you don't have a place to stay, we'll figure out and you can stay with us. If you don't have something to eat, we're not going to let you go hungry. That's what I love about Nationz Foundation, is that is at the core of what you do, to say, you're not going to go hungry. You're not going to not have a place to stay, and you're going to know somebody out here loves you, cares about you, and wants more and better for you. And I think that is a lesson that everyone could stand to learn, especially I think those who are so quick to point the finger at the LGBTQIA plus community. So I wanted to just say that, because I think that's so important.
Yeah.
I agree. And I did have a question. Do you think, I know back in the day, it was really, really like it just attacked the community, you know, like crazy. when you think about Studio 54 in the 80s and stuff like that? Has there been an improvement at all? I mean, obviously drugs have improved, but in terms of the stigma attached to getting tested and the stigma attached to HIV and AIDS being sort of exclusively to this community or that community, or has it kind of leveled out and it's not as directly impacting LGBTQIA?
So I think the stigma is still there. The stigma is still present. That's why having conversations like this, you using your privilege and affording a platform to educate, others about it is important. And I think that, like, that's why the work that I do is extremely important. Like the things that we offer, right? Nationz probably, and I'm just going to take a guess because I see the amount of positives that we get monthly, right? We at least find 2 new positives a month. So that's 24 in a year. And that's just new positives, not people who are lost to care that we link to care. And there is still, a lot of stigma about testing. A lot of people think that, oh, it's some drawn out process. It's not like back in the day where you had to wait 2 weeks to get your results. We actually have a test where we prick your finger, it doesn't hurt at all, and you literally get your results back in 60 seconds. And then if it's positive, we can confirm it with another test that takes about 15 minutes. So technically in 21 minutes, we can really, confirm your diagnosis, right? But we are, I'm going to toot my horn, we're doing amazing work in community, right? And so I'm a progressive thinker. I want to end HIV. I want people to be undetectable because we know undetectable is untransmittable, right? And so when you test positive at my organization, we can get you in with our nurse practitioner and get you on a rapid start program. So within 7 days of your diagnosis, you have seen my nurse practitioner and you're leaving my office with Biktarvy so that you are in on your meds. And then we connect you with a primary, like a physician, so that you can actually follow through with your care. And I also think that it's like really important for kind of to be a one-stop shop where you do testing, where you can get, combat the social determinants of health. So like folks can come get tested, they can get treated, they can get PrEP, they can get food, they can get transportation, they can get housing assistance. You have to be able to look at the person, the wholeness of the person, and making sure that, you are counteracting all of those things that are barriers for them so that they can stay in care. And I think that is what's happening with a lot of practitioners or other organizations. They're just solely looking at one piece of the puzzle. Like we're going to just look at this HIV, right? But it's all these other things that you have to take account for so that the person can be completely whole and completely well.
That is amazing. The work you're doing is amazing. We're going to get
Thank
that 2 down to 0, 2 a month down to 2 a year, if that. I love it. Education. I'm just sitting here like, wow, taking it all in. Thank you, Zakia.
Thank you.
And Nationz with a Z.
Yes, with a Z.
The Z is for me.
Zakia, Zakia. Zakia Nation. Yes. I love it. Yes.
I love it too. We're going to bring in Dr. Blackstock and bring in Reverend Robinson as well. Because I know I saw some head nodding and pen writing as well. I'd love to bring you ladies back in and to get your thoughts. This time around, I'll start with you, Dr. Robinson, Reverend Robinson, and then we'll come to you, Dr. Blackstock.
Listen, I have to admit, I have sat here during this segment and was just so convicted to be a part of a community who acts like we don't know what it is to be family. Many of us, just simply by having African ancestry, have been reared in families where it was just a blend of who was helping raise us. And so to be a part of a community that would ostracize, overlook, or put someone out because of difference in light of us living in a society continuously penalized for being different is so incredibly shameful, which I will get to later in my segment, because what I hate most about it is that we rooted in faith and theology and sprinkle Jesus on BS. And so I thank you for your courage and your freedom to profess the truth, despite how much society tries to silence it or overlook you. And so I start with just gratitude for the courage and the witness, and an apology on behalf of all the ignorant folk who have tried to even do harm, even in silence. And so I that's all I have to say now, because I'm, just grateful for this platform, this opportunity and space to share with incredible women who are doing what I believe is the real work of God, despite the way other people present the church. And so that's my immediate feedback right now, as I pray to get over my anger before my segment.
Thank you for that.
Yeah, no, that was beautiful. I totally agree with what Reverend just said. I was thinking, you are doing life-saving, life-affirming work. You're doing God's work. And I was just incredibly moved to hear thinking about all of the people whose lives you are literally saving. So grateful to you for all that you are doing. You mentioned so many things that I was like, oh my God, yes, yes, yes. I love that you mentioned, okay, so rapid start, again, people don't know that now, you get your HIV test. That's the gateway. If you test positive, you should get offered HIV treatment immediately. If you test negative, you can get same day PrEP. People should know this, as opposed to having to wait weeks, as you mentioned, that we can take care of you now. We have a plan for you, and you will be good, whichever pathway you're taking. Also, the idea of the one-stop shop that you mentioned, again, so holistic, figuring out what are people's priorities. I'm worried about housing, but you're going to get the HIV testing in there. And it also helps to destigmatize, sexual health, HIV testing as well. And just back to the fact that you stepped out on faith and started your own organization and you listened to the universe. That just resonated with me, because I did the same with my organization. But I think what you said is just, we are all here. We all have a purpose. We all have a mission, and you were following yours. And to see what impact you're making by doing that was incredibly powerful. And last thing, I have lots of things, but last thing was, the way in which your organization is literally meeting people where they are, with your mobile vans that you have. As a healthcare professional, I've often worked, in clinics and brick and mortar clinics. There's so much stigma. There's so many barriers to get people in. And we know that when we lower the barriers to care, when we go where people are, that it's much easier to engage folks, to get people connected. So I just wanted to say thank you to all that you said. I have lots more, but just grateful for all that you're doing in your community and the impact that it's having.
Thank you. And one last thing, you had touched on budget cuts. Virginia is facing those now. We have a program that was under the AIDS Service Education Grant that specifically funded our PrEP clinic, a lot of the services for trans people, and a lot of the housing and resources for trans individuals. So with budget cuts after June, we will no longer have funding for those programs. So we are looking, to figure out how to raise funds to keep those things going, because so many of our clients are going to be impacted because of that, and not knowing what our PrEP program will look like because of those budget cuts. And I've never, all the years that I've been in prevention, I have never seen so many emails about federal budget cuts and things that are happening with HIV prevention. So it just makes me, when you said that it was all connected and all tied in, it makes me feel like, they're trying to eradicate me as a Black trans woman and my people as LGBTQ people. And I would just encourage people who are listening, that sometimes people feel like, oh, this is their choice, to be this way and da 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 da. It's really not a choice. And, it is how we were born. It is how God designed us to be. But what I would encourage folks is to not, always looking at us and thinking about what we're doing in the bedroom, but think about that we are the most marginalized people, in the hierarchy of people, if you want to look at it that way. And anything that is passed to help us trickles up to everybody, right? Because we're so marginalized. And just look at how, the country is moving, with so many things that they have done as far as laws. And we just need to make sure that we are taking care of one another, because people that were not of color, when HIV hit, they rallied, they raised money, they used that privilege, they helped to eradicate it. And I'm gonna just say it, from white people, they helped to eradicate it within their community. But us as Black people, sometimes it seems like we have this crabs in a barrel mentality, but we really need to come together and support one another and love one another and raise funds and go to Congress and go to your General Assembly and go to your senators and your delegates and, talk about how this is still affecting Black and brown bodies, and they're cutting money. And, what are you trying to do to us as people? So making sure that you use your vote, your voice, and your vote when it's election time.
Use your voice and use your vote, because it ain't right. And if it can be eradicated in one race, it can be eradicated in all of them.
That part.
I'm sorry, y'all. I get a little hood sometimes when it comes to my people. I just, and I have to say, this is not the last conversation we're having about that. So get comfortable in this HIV conversation, because we gonna have another one and another one and another one until we can reach as many people as we can possibly reach. But I digress.
No, I mean, but that's the energy that we need, right? Because as Zakia just said, if that funding goes away, right? We already now have where we've got a government that doesn't really want to work for its people anymore, right? And I can say that, I feel comfortable saying that as someone who spends a significant amount of time in DC, on Capitol Hill, walking through those halls and in those congressional leaders' offices and participating in briefings and meetings, right? And there's a lot of work to be done there. But at the same time, that cannot be our only avenue for where we need to get the support and the assistance that we need. We have to realize what we already have at our fingertips, what we already have within grasp in terms of the dollars that are in our communities, and how can we get better and be better stewards of those. Zakia mentioned that when we think about marginalized community, which I like to just consider them under-resourced communities, our communities already have a level of ingenuity and forward thinking. They just don't have the resources to be able to activate on those things, or to become active on those things. And I think if we can figure out a way to, again, how can we learn better to support our own when we're thinking about where we want to give dollars or make donations to, I strongly encourage you to any of these organizations that all of these women on here are invested in and leading. Make a donation to them. I'm not saying don't do it, but we see March of Dimes, we see St. Jude, and I'm not saying don't donate to those, because those could be really extremely passionate causes. But at the same time, I know those are multi-million-dollar foundations. And I'm not saying they won't miss your $100, but I know that Zakia and Nationz Foundation could use it more, is what I'm saying.
Especially when funding is being cut out specifically to those organizations. It would be different if it was spread equally throughout, but we already know, without getting too deep, certain organizations get funding before others. So if you have underserved organizations, then the hyper focus should be on funding those.
100%. And as we shift, I want to, and I am nobody's preacher, pastor. That's not the calling on my life. But I do know that our word does challenge us and ask, to think about what we do for the least amongst us, right? If we build and create thinking with the least of us in mind, then it really won't matter who's after it or who's behind that. You're going to be all right, because I built this for the people who have less than you, which means you'll be able to access it. You'll be able to utilize it. You'll be able to take it, grow it, expand it, and scale it, because I built it for those who did not have. And with that, I want to now bring up Reverend Dr. Dominque Robinson, who I just, again, I only know you through Dr. Seal and Carrie here at the Balm in Gilead. And I'm really gracious that, they connected me with you to invite you to be a part of this conversation. And so to jump just right in feet first, right? So you said at a really interesting intersection, I think, right? Of this intersection of you're an educator, you're, in the, student kind of collegiate spaces, right? But then you are also in the church. And let's be more specifically, we're talking about Black church, which is different when we say church than Black church. We're talking about Black church. How is that being at that intersection?
And so listen, and then particularly as a woman, and a Black woman, who I would consider fairly young when we look at the landscape of Black preachers. It's an interesting intersection, but one that I find freeing because I don't serve as a pastor, which I think gives me the space to speak truth to power as free as I'd like to. And the benefit of that is I do serve in the academy. I do teach at a school, so I can say what I need to Black folk in churches. And in case they don't like it, my lights will not be turned off because I work over at an institution that is required to be more inclusive and understanding in a lot of ways. But it is a fine dance of being back and forth of what I would want to say, stewarding my platforms of privilege in a way to make sure that those who don't have space and or voice have access to it, because I think that's absolutely important. To be a Black woman, educated, serving, I teach preaching at a seminary in Austin, Texas. I served as a dean of chapel at an HBCU. Now I'm locating it more in Texas for people who are like, which one? It's in Texas. There's plenty, so figure one out, but it is not in Austin. To have done that, I know I wouldn't be where I am today if it weren't for my grandmothers who were marginalized, who were overlooked, and for individuals and people who have consistently poured into my life. And to be more transparent, particularly queer people who have poured into my life, supported me, because they were serving in the same church I was serving in and couldn't be themselves, right? And so I personally, at this point, maybe putting my credentials on the line to say what I need to say, but I could care less because truth needs to be said. And so we're having this conversation, and I loved how you asked, like, is the stigma still there? And it was like an absolutely. And I think for me, I would say it's happening because if we think about who we are as Black people, majority of us have some sort of faith or religious affiliation, not negating our Islam brothers and sisters or our Buddhist brothers and sisters or any others. But let's talk about these Black Christians who are still functioning with slave remnants on their behaviors. And so we have a way of using an inherited faith and a toxic theology to other individuals, yet it's the same rhetoric that has been used to other us. I'm always baffled at how Black people can minimalize other Black people living in these supposed United States of America and then use scripture on it. So you're using the same scripture that was used to justify slavery to turn around and demonize your siblings in Christ. I'm just baffled at how you're doing that with a white, blue-eyed, blonde Jesus on a fan, when if you read the same scripture that says he has hair of wool and skin of bronze, he somehow must be brown, which just lets me know, one, you're not reading your Bible, and two, you have no type of desire to truly understand it in such a way to be the beloved body of Christ you intend to be. So the stigma exists because when we talk about HIV and AIDS, number one, people want to make it a gay disease. So let's just be a buck. We're here. We're gonna go ahead and do it. They make it a gay disease, and because then they demonize and or make homosexuality a sin, they don't know how to deal with the disease. When you got other autoimmune deficiency disease out there, and you're not demonizing lupus, you're not demonizing rheumatoid arthritis, you're not demonizing, but somehow HIV and AIDS is demonized because you've associated it with a particular quote unquote lifestyle that you decided is a sin, and because it's often sexually transmitted. And Black folk have a hard time in churches dealing with gender, body, sensuality, and then we can get to sexuality. Because if we're serving in churches where you're a woman and you got to cover your lap or cover your head, you can't even deal with a woman's body, let alone anybody else's body, and you want to jump to sexuality. If you can't, if my kneecaps or my ankles is going to bring you to sin, baby, it's not me, it's you. And it's just the toxic understanding that you're sprinkling Jesus and scripture on hyper masculinity to want to turn around and demonize and harm individuals with the rhetoric of Jesus. I'm unclear because it says that Jesus was sent, as you said, for those who are most marginalized, most overlooked, and sent for us to be free, and not free from homosexuality, but free from being an oppressor. And so I don't understand. I'm getting loud. I'm raising my voice. I'm watching my tone. I don't understand Black Christians. I don't understand. And here's the thing. I don't seek to understand you. I don't understand Black Christians who use the Bible to harm individuals, and then who do not know how to properly support beloved people who are related to us, connected to us. Because there's not one Black Christian I know who can say they don't know a gay person, or at least somebody who's even in their family. So I'm confused as to how you're doing that, and then how you're making this disease, quote unquote, a gay disease, when any and every single one of us are susceptible to contracting the disease. And beyond contracting the disease, any of us are still impacted by the disease. So I just it's a disease, it's an epidemic that impacts all of us, but yet we somehow sprinkle Jesus on the BS of ostracizing individuals. And then our church is supposed to be a healing station, yet we're not offering any support, resources, and or prayers for the individuals who are impacted by it. And that's problematic for me. And so if there's anybody watching and you want to report me to my bishop, there are 12 of them, please report me. And if you're looking to take my credentials, please do so, because it doesn't take away from any of my education that I received or the ways in which I will still preach Jesus in this way. And so I'm
just gonna put her to work over here. You take the credentials if you want to. She has free reign, and you got a platform over here, sis.
So I need you to get out my head, because I'm like, can she just do this like nightly, weekly, every 3-4 days, 24/7? It's crazy to me how spot on you are and how important your voice is in all this AIDS and HIV awareness conversation, but just humanity overall. When you said sprinkle BS on Jesus, I need the t-shirt. We need to put you in touch with the trademark attorney. You this phrase, sprinkle BS on Jesus. I got to recover from that part. That's all.
I just don't know. I really don't get it. And I'm going to share a couple resources for people who are like, well, tell me, because I know we got some people who will say, well, all that education will make you lose your burden. So let me help you. I was born and raised in the Pentecostal church, and most of the people who were playing the organ and or the drums or directing the choir were queer individuals. So I don't even understand how first we can even ostracize people, yet we can use them. Let's turn around, not just with gay people. We do it with women too, right? So some of our churches don't believe that women should preach or could preach, but you wouldn't even know God if it were not for a woman who ever introduced you to God, and you wouldn't even be here without a woman. But it's all of the same rhetoric of oppression that we've picked up, and slave mentality that we now carry to continue to divide each other. It's like, do you even know your own history, from which the lands we've come from? Anybody who was queer, even in the continent, which is why I'm even more baffled now about the laws that are being passed in the supposed continent. Because if I read my work, what I understand is individuals who were queer were considered gods. They were considered individuals who had a deity about them, and they still do. So I first want to just start by saying, don't hear her preach and talk about, hey man, JL Perry, I act up. Me
too. I'm bringing the water and the snacks to the jump if we got to.
So I just want to start us with that we at times we read these scriptures, we take these inherited faiths or these inherited traditions, and then we perpetuate harm on individuals when we haven't taken the time to interrogate the scriptures we say we study or the faith we say we believe in. And then I really don't understand us as a people, brown people, and more specifically Black people, taken from our own land, get in these United States of America and continuously separate ourselves further, divide our families further over things that literally are not worth dividing us over, or not even things to be considered harmful and or sinful. And I think my Bible says that none of us are to judge. So we function like we're sitting in the judge seat. How do you know what sin is? I know somebody saying, because the Bible says, cool. I'm so glad you said that. There are 7 passages in the Bible that people oftentimes misunderstand and misquote to demonize those who are queer. But you cannot tell me there's a passage that tells you to not help anybody who has been infected or impacted by HIV or AIDS.
Facts.
You cannot tell me that. And what we do, and if you want me to go with you about those scriptures, we can certainly do that a whole nother time, another day, because those interpretations of those scriptures in its most rawest form are harmful. You want to talk to me about Sodom and Gomorrah? I hear you. Sodom and Gomorrah is about hospitality, not homosexuality. Because you have to explain to me how that passage speaks against homosexuality, but it was okay for the father to render his daughter out to be used as a sex Like, you got to tell me how that's okay. Then how one issue is greater than the other issue. I don't understand how you can use the same passage then that talks about cutting up a woman's body into 12 pieces is more appropriate than to say that it's against homosexuality. I'm just talking to you about your scriptures that you say you believe, that you use to demonize individuals. I'm unclear about how we got this. You talk about David and the Psalter, but there was something going on between David and Jonathan to be so close as friends. That's none of my business. It's just the way I interpret scripture. I'm asking you questions. And if I get here, then we're really going to go here. Help me understand how you understand a monogamous heterosexual relationship in the Bible. Because every man in the Bible had concubines and other spouses. And even the bride of Christ is called a harlot numerous times. So even if you're doing this based off of your understanding of marriage, I'm asking you to tell me again where you find a monogamous heterosexual relationship in the Bible that you're going to tell me about. So there are people who come at this various ways. It's about marriage. It's about sexuality. It's about toxicity. You need to tell me about this illness, this epidemic that's harming people, and what scripture you're able to use to say, I have to lift my hands and not help somebody to be healed and be made whole.
Woo! Baby, y'all see why? You see why I was doing happy dances when we finally realized we had all these three amazing women on here. Y'all see why I was sitting in this office just a few days ago, just hollering, but like, okay, this has all come together. And this is why. It is the authentic, unapologetic, right, conversation about what is really happening, and being able to call it out, to call it for what it is. And as you put it, that y'all are, you sprinkling this sugar on, this BS on Jesus, or Jesus on this BS, right? And really, I love how the way you just brought it back to say, basically, make this make sense for me, because everything you just said means that the math is not mathing. All right. So, you cannot say, well, it's really, like you said, it's about, the sanctity of marriage. Really? Again, point that out to me. It's really about, this. And it's almost as if, they're constantly hopping from one excuse to another excuse to really do what we are called to do, which is to to love each other. First and foremost, right? And to think about what true religion was meant to be, which is really to care for those who did not have, to care for your widows, to care, and we've gotten away from that. And you just, like, I cannot wait, because we're going to make this available. We're gonna break out snippets of this. You gave us at least 10 snippets that I'm sure we're going to try and send to you and use in some fashion or form with your permission.
Yes.
But it is this type of, again, just rawness, I think, and realness that we do need to hear from our leaders in the faith community, because it's just as much as Zakia pointed out that you have individuals who are being shunned from their home, not shunned, kicked out of their homes, right? Completely just
it sounds like homes and churches, but that's another conversation.
No longer in the church. You don't belong to the church. You're no longer my son. You're no longer my daughter. You can't keep my name.
It grieves
but then our churches are doing the same thing. I grew up here, and because now I'm coming to you and presenting in a way that, like you said, that somehow, causes you to clutch your pearls, I can no longer come here and serve and praise and worship my God, the God that I still know and believe. And again, that the women with, again, I'm like you, if our kneecaps is giving you, honey, that you need to go be talking to somebody, okay? Because I'm like you, it ain't us.
If it's my kneecaps, then baby, you ain't gonna be able to handle nothing else, because listen,
and this red lipstick that I have on would absolutely be a no.
Oh,
baby, and out of nowhere, and now I'm here, I'm just messing with people, and I'm gonna keep messing with her, because the red lipstick is, oh no, she's a Jezebel. So I'm trying to understand. Jezebel was never even a sexualized individual in the Bible. She was a woman who told her husband what to do to get stability. Now we can go into the fact about how we don't know why her husband wasn't already doing it when he was in place and position, but y'all mad that Jezebel handled the business. Now it might not have been done right, but if we're gonna use your heteronormative cisgendered roles, then baby was out of place. So Jezebel had to speak up. But it's funny how we put red on Jezebel and sexualized behavior on Jezebel, when in actuality, maybe the critique was controlling, and it was controlling because matters were out of her hand. And it's funny how people critique that. Most people who critique it are control freaks anyway. But I'm neither here nor there. What I want to do, though, before we shift, is offer some resources for people to read, as far as just to explore some concepts around the way you're bringing your faith in conversation with some of these things. They don't necessarily touch specifically on HIV and AIDS, but they at least help you to reevaluate how you're seeing marriage, how you're talking about homosexuality related to the Bible. So I just want to share these things with you. As you all tune in, you'll be able to see ways that you can contact me. I probably will not speak to you individually one-on-one, but I will tell you some questions to ask your pastor, because my concern is not the people. My concern are the pastors. My concerns are the preachers. I believe that the church is just as much as any other organization, a supply and demand. And I feel like pastors need to step up and start giving watered down, sugar-coated sermons and words or practices so that our people can mature and can ask hard questions. I think most of us, or the people who are faith leaders, don't approach these things because they haven't done the studies themselves to be able to fully understand. And here's the thing, dear pastor, you don't know everything. Bring other experts in to have the conversations and figure it out. We are a community of wealth, and part of us believing in our anointing is trusting that our siblings are just as anointed and bring gifts to the body so that we can all serve each other well. And so I want to share just a few pieces. One, I want you to know that Dr. Daniel Black is one of my favorite authors, and he does do an amazing work of bringing in conversations around faith and homosexuality, gender and identity in a book called Perfect Peace. It is a novel, but it's called Perfect Peace. So I recommend this text to any pastors who want to just say, here's a way to introduce a conversation. It allows people to read it together as a book club, and then potentially, without people telling their business, they can talk about the characters in the book to help process some of these concepts and these faith. It's helpful. It's called Perfect Peace, y'all. It's an amazing book. Now, here's some other things I want to share. There's a book called Bible, Gender, Sexuality, Reframing the Church's Debate on Same-Sex Relationships. Ready? Bible, Gender, Sexuality, Reframing the Church's Debate on Same-Sex Relationships. There's chapter 12 written by James Brownson. In this, he readdresses the 7 to 12, what I call clobber text, scriptures that people use to demonize homosexuality and or queer individuals. So I want you all to read that because he digs into it. There's an author, her name is Patricia Hill Collins, an amazing scholar, 2 books, Black Feminist Thought, Knowledge, Consciousness, and the Politics of Empowerment. But this is the one I really want you to touch on: Black Sexual Politics, African Americans, Gender, and the New Racism. You all need to understand that these books are helpful for reframing some things. The last thing I will give you is this, by Delroy Constantine Simmons, The Greatest Taboo: Homosexuality in Black Communities. If you would just take a look at some of those books, some of those resources, you'll see how the concepts around Bible, faith, Black communities, the way we have bought. Oh, I got to do this. I'm sorry. I got to go to this one. This one, I'm sorry, it made me think about it. Kelly Brown Douglas. Ooh-wee. Wrote 3 pieces y'all need to get. If you're going to start somewhere, do Perfect Peace. It's the kind way. But if you want to dig into how slavery has impacted Black body, Black dysmorphia, Black image, and how our sexual reproduction was used as commodification, and now we use it against each other around motherhood and or queerness, you got to go to Kelly Brown Douglas. Kelly Brown Douglas, these books: Black Church Homophobia, What to Do About It; Sexuality in the Black Church, A Womanist Perspective, and What's Faith Got to Do with It? Black Bodies and Christian Souls. Listen, y'all. Only because my queer scholars would tell me, make sure I lifted this up too, by Horace Griffin, Their Own Receive Them Not: African American lesbians and gays in Black churches. Listen, I gave y'all about 9 resources. That lets you know I'm a professor. Read them. That's your own bibliography, your own lit review. These sources will be helpful, and maybe we'll come back to have a conversation. But Perfect Peace is amazing, and Dr. Daniel Black will be incredible to have on the platform to talk about his book and the concepts. But I wanted to share that with you all, so you can't take me for my word. There are scholars, resources, and writings out there for you to explore why you believe what you believe, why you think the scripture says that, and then ask yourself, how true is it in real life, and how helpful have I really been a witness of Jesus Christ by negating somebody from access and denying their full humanity with my faith?
Ooh.
Baby.
Yes. All
that
of
I
that.
can say. I love it. All I can say is that we have to make sure we get the links to those books. And we put them below, drop them below, because it is so refreshing to hear someone speak from a place of sexuality and religion or spirituality. I know so many people who have been victimized by, what is it? Putting Jesus, whatever it is, putting the
t-shirt,
bull sugar honey iced tea on Jesus' name. You feel me? And I think that it's so important for people like you to share the information that you have to change those perspectives, because you would be blown. And when you said every church, not every church, let's not put that on everybody, but we've all met somebody from that community. We've all loved somebody from that community, and we have, some of us have participated in the judgment. So thank you for that one. That was so far. I don't even have no questions. I don't have no I'm sitting here wanting to pass the offering.
I'm gonna bring Zakia in because I love to get your thoughts, Zakia, on that. That was a word indeed.
Very powerful. And Pam, my relationship with church and how I am about God and Christ. And Pastor Robinson, you was on point. My pastor, my former pastor, his name was Kenneth E. Dennis Sr. And I go to probably one of the oldest Black churches in the heart of Jackson Ward in Richmond, Virginia. And one thing, when I transitioned, I stopped going to church because I was so worried about what people were going to say, about my transition, because I grew up in the church, and my grandmother and my mom. And so when my grandmother passed away, my pastor came to the house and he was like, well, where you been? Ain't nobody seen you in a long time. You know what I'm saying? You need to come on back to church, right? And I was like, Reverend Dennis, I ain't trying to go back to church to deal with, them people. He was like, if anybody have anything to say about you, then they need to find another church. And one thing that he used to always say to me, and when people used to talk about Sodom and Gomorrah, Revelations 31, and try to use all of those scriptures, right? He used to always say, God so loved the world, he gave his only begotten son. God so loved the world. He didn't discriminate against anybody. He loved everybody. So I really appreciate all that you added in your segment. I hope that you are live somewhere so that I can watch your sermon somewhere, because it's powerful. And I do think that ministers need to educate themselves, need to stop preaching so much hate within the church, because a lot of times I remember when I did not have church to go to, and that relationship right in church, how low my spirit was, and how difficult life seemed to me, not having my family, not having church to go to. The good thing is that I always knew that your relationship does not have to be in the church. You just need to have a relationship with God, right? And a lot of times when people use Revelations and talk about all that was going on in Sodom and Gomorrah, it wasn't about what they were doing. It was about they were doing all this stuff and they were not worshiping and praising God while doing it. And that's why all of the havoc happened, and I know a lot of people think that my life is a sin and the decisions that I've made is a sin. But the universe and God tells me different, and there is always blessings happening for me. And and my pastor said something that you both said, that the work that I'm doing is God's work. I'm feeding people, I'm housing people, I'm taking care of people, and it's evident when my friends always talk about how big my heart is, right? Because I give, but then the universe give it back 20, 30 times, so it can't be a sin, even this space is a blessing. To be in Nicci Gilbert's company is a blessing, and being able to talk about the work that I do.
The blessing is mine on this here evening, but I digress.
But you just said a mouthful, and I'm really proud of who my new pastor is, because he's just as progressive, Dante McCutcheon. And he's amazing, and he always talks about inclusivity and loving one another. And so you were dead on. I was sitting in the back just like going up, because I wish so many more ministers had that thought process and were as progressive. Excuse me.
Wow.
This was incredible. This was absolutely incredible. And wow. Pam, I'm just blown away.
I'm trying to,
great.
I knew we were gonna get a word. Like that much I knew for sure. So I was like, okay, how are we gonna do, let's get educated first. Like what is this thing? What's going on? What statistics? Why are we still talking about it? Let's see what we're doing about it in terms of all the amazing things that Zakia and through her foundation is doing. And I was like, but we got to, what's the bow on this thing, right? And again, I think everything you just said really ties all of it. We can have 100 Dr. Blackstocks. We can have 100 Nationz foundations, right? But the one place where we grew up in, we were reared in, stewarded in, went every day of the week, 2 and 3 times on certain days of the week, to then ask us to lay that down simply for how we are showing up in the world, how God has called us to show up in the world. I'm like you, I can't wrap my head around how that could make sense for anyone. And as we think about not just this awareness day, and I know Dr. Blackstock had to leave us, but I know Nicci, and I know her heart as well, for wanting to make sure that our communities have the education that they need so that we can make informed decisions, that we can do more with what we have, with the resources that we have, with the ears and the attention that is on us for whatever reason, but to be able to use that in a way that is going to shift consciousness, that's going to shift awareness, that will shift us then being able to take action. I know that's important. And I really, I want to make sure that we can connect all 3 of you in an email, as long as I'll make sure everyone is okay with that. Because I want not only for us to be able to stay connected with you and the work that you all are doing, but I also want you all to be able to stay connected together. Because I think there is some beauty in the work that all of you are doing that fits in to say this is God's work. Because we're all saying we got a heart for his people. And I'm trying to help God's people be everything that he has called us up and to. And so again, my heart is just really, really full, I think, with just the amazing conversations that we've been able to have on tonight. And while we were talking about, yes, it's Women and Girls HIV/AIDS Awareness Day, these are conversations that we need to have for our young men, for the men and males in our lives, that we need to, this is for everyone. This isn't just for, women, although it was on women on here today. And as Nicci said, we will continue to have these conversations and have them as often and frequently as we can. I already know that I'm sure Nicci will be like, hey, I want to, we need to get this person back. She does nightly shows. She Speaks Live, which is a weekly show. And all of this that we've talked about today are very much the things that I know her through her foundation, through the work that we're doing over at WIRF Media. It has to be included in that, because we can't just bring entertainment to our community, and we can't just, bring parts of ourselves to our community, but we got to be able to bring our full selves into these conversations. So I just can't thank you enough. Before we let you guys go, so imagine, right, if we if budgets were not getting cut, if we had more Reverend Robinsons who understood the importance of getting in your word and really understanding your word, of being educated on the word itself before we go out here and try and tell others what it means. What would you all call and challenge our communities to challenge our moms, our business owners, our leaders in every facet in industry, faith leaders, business leaders, school leaders, what would be your 1 to 2, I'm going to say demands. I'm not even going to say call to actions. Your 1 to 2 demands of those who are in positions of authority, in positions of power, so to speak, to say, I am demanding this from you to help us in this epidemic in our communities. And I will start with you, Zakia.
So this is something that, you know, I just was having a conversation with someone just a few days ago. You know, a good friend of ours is thinking about running for political office, and they asked me some questions, and I was like, you know, I really want to see funding increased as far as prevention. This is something that's extremely important, so I would like to see more dollars put towards prevention. I would also like to see more of a status neutral service navigation approach for funding, so that we can provide a holistic approach to those individuals who need help from us. So, you know, touching on the reasons, you know, and making sure that we're able to help with housing, with food, with transportation, with social support groups, just not decreasing the funding, increasing.
Love it. All that. So yeah, so we saying basically y'all need to get your checkbooks out. Because somehow we managed to print money and vent money. I don't know where they pull it from when they feel like we need to pull it to give it and put it somewhere. And I think this is very much an area where, yes, because like you said, Zakia, if we could get to the root, and that's whether we're talking about HIV, we could be talking about Alzheimer's, we could be talking about any other disease that disproportionately impacts communities of color. One of the biggest issues is the resources don't there. We're not getting to the root of why this is even happening in the first place. We're not getting to the root that people don't have stable housing, that transportation is still an issue, that people are not, they're living in food deserts. You're telling me to go eat healthy fruits and vegetables, Doc, but I haven't seen a fresh apple, orange, grape, banana, unless I have to go 50 miles and I don't have a car to get there. Right. So if we don't build programs, initiatives, and fund them to address those things, and we're so far down that pipeline that, we're just going to do just enough that might hold you, but it's not going to do enough to heal you. And it definitely is not going to do enough to be able to think about when we look at generationally. How are we going to change those? It's the roots. It's the understanding those ancestral roots. It's the understanding of what was broken and taken and stripped from us when we got here, right? And how do we go back and be able to restore that? And so I love that, that is a demand to say we got to be able to have access to that level of resource to address those root causes of why we continue to see such alarming rates of HIV in our communities.
And I'm back. I just wanted to say I apologize for the technical difficulty. The devil is a liar. We know this to be true. The devil is indeed a liar. Yes. And I wanted to say, before I get bopped off of here again, I am so grateful for the contributions that each of you has made to this conversation. It is so important for us to have real dialogue about what impacts our community. And it's so important for us to understand that family and churches and celebrities and media personalities and folks like that have a huge responsibility to embrace women, LGBTQIA community, children when it comes to fighting this curable. Well, obviously, if you can get to the point where you can't even transmit it, that's as close to being curable as possible, right? And I'm so grateful to each of you, and I'm going to take it as my responsibility and my marching orders to make sure that we speak more openly about it. Because I just want to say real quick, I would be remiss. My soror, Haidia Broadbent, and I remember seeing her many years ago, and just feeling like, wow, this is a child who was born with this disease, and she has been able to thrive, and she has been able to be successful, or had been able to be successful and advocate for so long. So we have to continue amplifying those voices in our community for sure.
100%, because it's thinking about you know, the shoulders that we stand on, right? And she was a giant. She was, you know, probably ahead of her time in some ways, in terms of being the face, the Black face of a disease that we just did not know enough about. She was diagnosed so early and at such a young age, and so she lived through, I think, as Dr. Blackstock mentioned, she lived through the time and point where we didn't have the treatments that we have now, and so that, you know, just goes to show you how long we've been, you know, in this, you know, fight. And it's really, really important that, you know, we lift up those leaders. We think about their, and we honor, you know, think about how we can honor her legacy and the legacy of so many that we've lost, you know, to this. And then Reverend Robinson, with you, I want to, again, what would be your demand, again, for those who are in, you know, the powers that be, we'll put it that way, for the powers that be, what would be your, you know, 1 to 2 demands from them to say, this is what y'all need to do, must do to change this narrative?
I think my demand would be for all of us is to imagine the person you love the most, even if it is yourself, and treat everyone as such. Like, I'm demanding us to function in love, in real love and radical love, which requires radical hospitality, which requires selflessness, which requires understanding, to function in real love. I believe, I do, and maybe this is the gullible part of who I am as a preacher, I do believe that love can override a lot of the issues that we are experiencing. I do believe that love could be the cure of the epidemic we know as racism. I do believe that love can help us overcome many of the isms. And I just challenge each and every one of us, whomever you believe you love the most, whether it's self or it's mama or it's spouse or it's child, can you treat the other just as well as you would treat that person? And I think that if you could do that, then we would be able to be in a place that, as you said, get to a place of curing not just HIV and AIDS, but probably many of the diseases and diseases that we find ourselves in this world.
Wow. Love, right? That's the fruit of the spirit. If my Bible, you know, recollection is correct, and it's, you know, the greatest gift we received from our Heavenly Father. So I mean, yes, if that can't fix it, you know, we in a bad way if love cannot fix the ills that we are experiencing. So I think that is, yeah, that is an awesome demand, and starting with, yes, who we love the most, and that hopefully, yes, is ourselves is somewhere included at the top of that list. But if not, you know,
love
I think that's a
literally
whole
heals
nother
all things, because if you love somebody and we spread more
Yes.
love, then there's less stigma attached, more people who are able to go and get tested, more people who are able to go open up those conversations. It really is the cure for everything, period,
Yes.
at the end of the day.
Yes.
And I guess that's why God is love.
There you go.
There that
There
is.
you go. See, we, you know, and here y'all were thinking we were gonna have just a regular conversation about HIV, but I can guarantee you, having been a part of many, they're not most that are going to have, I think, the level of conversation that we've had, you know, during this conversation. And again, you, Dr. Reverend Robinson, and Zakia for being a part of that, and Dr. Blacksmith, who had to leave early, have helped us, what I hope, and those who have been able to watch, those who will watch as we, you know, re-air this in its fullness, and as also re-airing it in you know, some snips that we really want you to make sure that you take home and let them sink in and marinate with you. The resources that Reverend Robinson shared with us, that we will make sure that we get that list and make it available to you in some shape, fashion, or form. So we will definitely, you know, make that as a kind of follow-up, because we want to continue this. We don't want to just have this one conversation here and then we go on back into our lives and not even thinking about it again. We want this to stay and stick, with us, so to speak, so that we can continue to carry this on. And we're not quite done yet because, as Zakia pointed out, Miss Nicci Gilbert-Daniels, right? Okay, so this is a sister, y'all, who, like I said, I love dearly for her heart. And I love when we say her platform. So, she's multi-hyphenate, multi-talented, executive producer, singer, songwriter, you name it. She has multiple hats that she wears. Nana, she's wife, she's sister, so many, many different things. And I know that you are extremely passionate about the role that even we talked about physicians, we've talked about community, we've talked about the churches. But there's this also big push in terms of media and entertainment and how we even in that space have talked about HIV, how we have depicted stories about HIV and AIDS, particularly in women. And so I want to take a minute, while we're, all here with you to get your thoughts on what's still needed. I'd love to get your view on some of the maybe more prominent movies, such as For Colored Girls or even Temptation, the stories of a marriage counselor, where there were, undercurrents of HIV. I'd love to get your thoughts on that. No, you're muted. Oh, you're muted, Nicci.
Can y'all hear me now? Can you hear me now?
You.
Okay. All of these technical difficulties, in Jesus' name, amen. I think that there is a very important responsibility for entertainers and media personalities to continue, like you mentioned, the films that you mentioned, to continue to make sure that we're telling those stories. I'm always advocating for better narratives. I'm always trying to figure out a way to have more authentic representations of who we are and what we're going through. Somebody said something to me really profound, and it was that there's always a lesson in every Disney movie, right? There's always a moral or a lesson in every Disney movie. And I think in the Black entertainment and media community, we have to start thinking that way, right? We reach more people with our platforms. And I just think that it's hugely important for us to continue to amplify messages about getting tested and taking the stigma off of AIDS and HIV. Nobody wants to be a part of the real conversations. Well, obviously some people do because we're here, but I think more of us need to make it our business to amplify this conversation, because that is the reason why it doesn't impact other communities, because they have been able to leverage. I think when we talk about We Are the World and we talk about That's What Friends Are For, imagine now with us having even more of an opportunity to reach more people. Imagine what it would look like to have your favorite creatives, your favorite artists come together and do a fundraising song so that Zakia doesn't have to worry about being defunded. So the revenue, you understand what I'm saying? It's just the power is always in the people. The people are always easily reached by those of us in the media with the platforms. And it's just time for us to not be sugarcoating it anymore and be fluffy about it and be transparent and direct. And sometimes direct, loud, and aggressive pursuit of a better narrative is the only way to go. And I think it's important for everyone watching this, everyone who will watch this, to take the responsibility that comes along with the platform and amplify the messages that help save lives in our community. Zakia is saving lives in the community every time she goes and rolls up to an event.
Yeah. And
Dr. Robinson is saving lives in the community every time she opens up her mouth and says something that we need to hear. Pam, we are all working our butts off. Dr. Oni isn't here, but same thing. I think the entertainers and media personalities have a responsibility to the community to make sure that we're doing the small part, because y'all are in the trenches. Y'all the Marines in this battle. And I think entertainers and media personalities could at least be the Army.
Yes. Well, you're a part of that. If you know, as that army gets moving and that army gets rolling,
boots
you
on the
definitely
ground.
definitely be.
But we got
one of
to,
the leaders.
yeah, we have to support people in the field. Period.
100%. I can't thank you enough. Again, I think for just always being willing to have these conversations, because I want to let y'all know Nicci did not have to say, okay, sure, Pam, this sounds like a great thing to do on Sunday. She actually has her nights with Nicci that she's always on every weeknight talking about something that we need.
I'm trying to be consistent. It's hard.
And that we need to know about. So I wanted to be clear that she didn't have to say yes. You know, Zakia didn't have to say yes. Reverend Robinson didn't have to say yes. Dr. Oni did not have to say yes. But your yeses meant so much to me. I, been seeing the folks we can see and hear. Got another screen over here looking at some folks that don't pipe into here, and just even hearing how many times in the comments people were saying, we need to hear this. We need to talk about this. This is, so it lets us know we're at least in the vein where we're doing the right thing, that people
order
really
steps.
Do. Yeah.
And thank you, Pam Credible. Now y'all know why I called her Pam Credible at the beginning of this here thing. Because I have to be reminded. We have to be reminded. Use your platforms to enrich the lives of your people, or just jump off of it, because you're not contributing anything if you're not being honest, transparent, and working in the direction of saving. We do need to save ourselves and each other, but saving each other is a prerequisite for saving ourselves as a collective.
Wow. And on that note, just one more announcement, and then I would love to ask for everyone to kind of just give your final thoughts on what we've all been able to talk and share with today. And so I know that Dr. Oni mentioned it, and that's the CDC's Let's Stop HIV Together campaign. And she is a clinical ambassador for PACT as deputy director of the Balm and Gilead. We are a PACT member. We're a PACT organization, so we are working hand in hand with CDC to do many of the things that we've talked about here today. And one of those that I'm excited to share is that we have been pressing them to say that we've got to get more voices at the table to think about, what CDC needs to be doing, what CDC should be doing. When we think about the materials that are being created, I can tell you firsthand that sometimes they just don't represent us in the way that we know this is how we're showing up in the world. And so I'm really excited that they are starting to listen to that. And there is an opportunity that they are making available, especially for Black women and girls, and that is both our cis and trans women as well, to be able to participate in listening sessions starting in April through May. And CDC they want to hear from you, and that's rare that you will have a federal organization who is carving out the time to say, no, we actually want to hear from the community and see what your thoughts are on testing, on PrEP, condoms, on viral suppression, and the being undetectable, as well as just our general sexual health. Right? We keep wanting to just make it about HIV, but it's not. It's about, I want to be able to have good health. My health is my mental health, my sexual health, my heart health, my brain health. We keep wanting to slice it up. It is health, period. Mm-hmm. And so I'm excited that they are extending these opportunities. If you or someone that you know would be interested in participating in one of these listening sessions, please make sure that you shoot me an email at Pamela@FromTheBottomUpFoundation.org, or you can send me an email at pprice@balm, BALM, in Gilead.org. Either one of those emails will work, and I will definitely make sure to put you in contact. We are also working for WIRF Media and the foundation to be able to host at least one of these listening sessions, seeing as how we are right in CDC's backyard in Atlanta. So that is in the works as well, because again, they're asking for our voice, so we need to show up, because we don't want them to say, well, hey, we gave you an opportunity to hear from you and see what you needed and what you thought would be useful, and then no one shows up. So this is on us now to be able to do our part. And this is a really exciting opportunity that we wanted to make sure that everyone was aware of. So on that note, we will begin to wrap up and ask everyone to give final thoughts. I will start with you, Zakia. We'll go with you, Reverend Robinson, and then Nicci, I'll let you have the final thought.
I just really want to say, just do unto others as you would have them do unto you. Treat people with kindness. You never know what someone is going through. So just do unto others as you would have them do unto you, and use your privilege to uplift other people. And Pam said it, support smaller grassroots organizations who are on the ground and doing the work. We need your support. It's extremely important, especially during this time. So if there are organizations in your community that are doing life-changing work, support them. If you want to write a check to Nationz, please feel free. And I'll drop our social media in the comment section. So if you want to learn more about the work that we're doing. Thank you.
I first just want to start with, again, a sense of gratitude, an expression of gratitude for this opportunity to share and to share this sacred space with all of my sisters who are out here doing the good work, the hard work. And what I would say, as my grandmama would have taught me, I'll just offer, standing on my own spiritual authority, I speak life to every single one of you who is tuning in and watching this. I'm speaking life into the dry areas of your life, financially, emotionally, spiritually, physically, relationally, psychologically. I am speaking God's greatest abundance over you, that the blessings chase you, overwhelm you, and that your mind is blown by the open doors that God is getting ready to prepare over you. I'm prophesying over you healing from the inside out. I declare and decree that peace will be in your mind, that you will not wrestle with insomnia anymore, that you will overcome anxiety and depression. I'm declaring that God's best will be assigned to you, and there's absolutely nothing you can do or say about it. And because I know better, that when the children of God gather together, Satan goes to and fro seeking whom he may devour. So I stand on my spiritual authority and say, Satan, you have no power. Take your hands off of God's children. You and your imps and your legion go back to the dry places from which they've come from, and we pluck up every curse from the root from which it comes from. And I plead the blood of Jesus over every single one of us. And I pray that any and every toxic thing that has ever occurred to you from a faith community is overturned, and you know that the love of God is real, and that you experience that love of God, and that this epidemic, along with every other dis-ease in this world, is healed. Those are my final words that I'd like to share with each and every one of you.
Amen. Amen. Amen.
Amen.
Wow. Like I've said throughout this whole broadcast, Pam, so grateful for you. I'm so grateful for you, Zakia. I'm so grateful for you, Dr. Dominque, Dr. Oni, Allie, our whole team, Lauren. We are, here, and we're definitely going to continue to use our platform. I'm using mine. This is our platform to amplify the voices of underserved people, especially Black and Brown people, because we're not just imagining that there is a disparity in every aspect of our lives. There is discrimination, racism, lack of opportunity everywhere we look as Black and Brown people. And it is now time for us to be more proactive than reactive in our approach to some of these solutions. We've cried about it for a long time. We've complained about it for a long time. We've prayed about it for a long time. Now actions. You see, now actions speak loud. Okay, I'm gonna stop. Wrote a song about it. Want to hear it? Here it go. If you love us, if you love me, if you love all of us, then please share this message far and wide. Other communities are not impacted by it the way we are. And this is National Women and Girls HIV Awareness Day. And we felt like it was very important for us to have this conversation because we talk about a lot of things every single day in the media. We talk about a lot of celebrity beef. We talk about a lot of gossip and innuendo. This is like real, actual stuff that is happening in our community to people we love. And when you think it don't reach your house, understand you got generations after you that you have to be proactive about helping eliminate, obliterate, get rid of, end AIDS and HIV. And I feel like this conversation went much deeper than that. And I'm excited to continue to explore the relationships between church, sexuality, LGBTQIA community. So this is definitely not the last time we will be having a conversation together for sure. I can promise you that. Pam, you opened us up. Close us out, sis.
Thank you again, everyone. This has been awesome, and even better than what I had imagined. It could be in terms, I think, just the richness of the conversations. I think of the importance, and again, I think just the beauty of what we centered around in terms of just love, right? Of love being at the heart of everything that we do, of love being our why. Okay, I'm a big proponent of understanding what is your why. Why are you getting up and leaving your house every day? And what is your why for wanting to put the things out into the world that we put out into the world? And I think we definitely need to put more love out into the world. That would be my final, clothing thought, is to put it into the world. And also just to say that I want to thank Reverend Robinson for that prayer. So I live with bipolar disorder, and I'm in a midst of a manic episode that I've been in for a couple of weeks now. And so insomnia has been a really, really tough thing right now. But I'm telling you, based on your prayer, I'm claiming tonight that I will be getting some much needed rest and sleep. And so again, I want to thank you all for your yeses tonight. And for all of those who were able to join us on wherever you joined us. We streamed a lot of different places tonight, y'all. So we were not only just with you who joined us here on the StreamYard, but we streamed you to Facebook, on YouTube. You were in some LinkedIn's. You were definitely on WIRFTV.com. So that is a space that Nicci is creating, where she is curating content that, again, is not just going to educate us, but that's going to inform us. It's going to uplift us, encourage us, and more importantly, it is centering Black women. It's created by Black women for Black women, with our lens, our spin, with all of our Black girl magic is on it. So if you have not been able to check that out, please make sure that you go, that you subscribe, that you like, that you register, because there's just going to be some amazing things. And conversations like this will be a part of what that platform is all about, which is why I'm so excited to be a part of it and being able to work with Nicci and our entire team, to Allie, who helped me run through all the tests so that we could pull this off tonight, to Lauren, to our entire team, all women led, all being driven by our passions to want to see our people and our communities be healed, be whole, be healthy, and to be fruitful and to multiply in the best ways possible. So thank everyone tonight for joining us, and we hope you have a blessed week ahead, and we hope to see you again soon for another important conversation. Have a good night, everyone.